Hello and thanks for watching again. I wanted to do a update video. It's been many months since I've done one, and I really want to just share where I'm at, how far away I'm out, and just impress upon all of you who are thinking of having spine surgery or who have already had it that this is a long-term recovery. So I think I had surgery in June of 2018. I had an L5-S1 microdiscectomy, and it is now October of 2019. So I believe that's about 16 months since I've had surgery, which is exciting. If you've watched some of my other videos, you may know that I re-herniated the same disc, L5-S1, about 8 months out of surgery, probably because I was not adhering to a very strict physical therapy routine, and I was snowboarding again. So that's what happened. I re-herniated. I had very bad low back pain and tightness in my piriformis for about 6 weeks. I thought I pulled a muscle in my butt, but no, I re-herniated again because my nerve pain came back after that. I was seriously considering a revision or a second microdiscectomy. However, I luckily, after about 3 months of just waiting and doing some exercises and trying some other things, the pain subsided enough that I could live with it. That, let's see, was in March. So March, April, May, June, July, August. So that was about 6 months ago when that started. And I'm now, I guess, 6 months past my re-herniation, and I probably feel a tiny bit of nerve sensation every day. My toes will tingle, or I'll get a little twinge in my tushy. But for the most part, I don't have painful days. Every couple of weeks, I might have a day where I'm really sore down that nerve string, down through the butt and down the leg and into my foot. But it doesn't get much worse than like a pain level 5. So I feel like that's pretty lucky. And to me, I'm an active person, and I prefer to skip the surgery because the recovery is so long. I'm also self-employed, and I just can't be out of work. And I also didn't feel debilitated by my pain the second time around. The first time I re-herniated, or the first time I herniated this disc, I definitely was disabled. For about 6 months, I couldn't like walk very far, stand up straight. Definitely, I was pulling up a chair to the stove so I could cook dinner because sitting felt better than standing. So if you're going through this pain, you know what I'm talking about. I think what I've really just I'm on my 3rd round of physical therapy now. I have had some insurance snafus where they only will release a few visits at a time, which is really unproductive. If you can find a way to get into a consistent therapy program, I think that's going to be your best bet. This time around, I had 8 visits. I have 2 left, and I have a different therapist than I had previously, and she is way better. I'm gonna say it. The other guy, honestly, wasn't that great. We're working a lot on my transverse abdominal muscles. You can look that up. And making sure that I'm doing posterior pelvic tilt. So I'm not really doing anything strenuous in physical therapy. I'm simply laying on my back rotating my pelvis into posterior pelvic tilt and then just like lifting my legs one at a time, or sometimes they'll put a blood pressure cuff under the small of my back and I have to push it down and see where the dial goes, and then I've got to, kick my legs and the dial can't move. That's very difficult. So it's really all about training your body to rotate that pelvis the right way before you engage in an activity. I will say I'm a snowboarder, and I live in Colorado, and this last weekend, one of the resorts, well, two of the resorts, but one that I have a pass to, surprise opened very early for the season, so we decided to go snowboarding last minute. And I was snowboarding last winter as well, which is how I re-herniated my disc. And we did 3 runs this past Saturday, and I felt so much stronger. I think I was exceedingly ambitious to get back on my board 6 to 8 months after spine surgery. My surgeon said I could do it, and he's right, I could, and I did, but I shouldn't have. I think I should have taken all of last season to strength train instead and not been so impatient, because I can already tell after literally 3 runs on the mountain that I'm stronger this year. I'm not where I want to be. I'm not back 100%, but I'm 80%, which is fantastic, because last year I was probably 40%, maybe, and I hurt myself again. So the lesson in all of this, I think, is really that this is like a 2-year recovery, fully, if you're an active person. It's not, and when I say recovery, you can recover from the surgery. I mean, technically after 2 weeks, you're fine to go back to work, right? Okay, cool. But then there's another 10 weeks after that where you can't lift or twist or bend. So that's really your recovery is 12 weeks. But then there's like this rehabilitation period that isn't talked about a lot. I think your surgeons say, yeah, you're gonna need to go to physical therapy, this, that, and the other. But if you are an active person, it's gonna take a long time to get you back to your level of activity that you were at before you got hurt, and that's okay. I am still struggling through beginning yoga, which I wasn't struggling through beginning yoga prior to my injury. My balance is a little rickety, but much better than I anticipated. And I will say my biggest struggle in yoga is like when you're in a low lunge, okay? You got one foot this way and you're in a low lunge and you have to come up to crescent, and you've got to use that core to lift you up. You need to do that while maintaining a posterior pelvic tilt, and I can't do that. I don't even have the strength to really get myself up without using a lot of tools. So right now I'm staying away from yoga other than just balance and floor stuff. Yeah. Working on leg strength, working on my form in my squat, and working on always saying the words posterior pelvic tilt before I do anything. I think I went down that mountain this weekend and that's all I was repeating to myself: posterior pelvic tilt, posterior pelvic tilt, and lead with my shoulder, because on a snowboard you can't be having your top and your bottom twist like this. When you turn, you need to turn this way and turn this way, and you need to stay straight, no twisting to turn. That's what got me into this mess. So anyway, that's just where I'm at. 16-ish months out of surgery and about 6 or more months past a re-herniation on the same spot. If any of you are going to ask, well, I'm just trying to think of the questions you're going to ask. As far as the re-herniation, yeah, it hurt, and I was literally ready to schedule my second surgery. And there was just some tiny little piece of me that was like, maybe I don't need to. And I didn't need to. So if I live with level 4 pain here and there for the rest of my life, I personally am okay with that. That's a personal choice. If you choose to have spine surgery again, that's awesome. But know that you only get 2 microdiscectomies. And the third time that you hurt your disc, you will be a candidate for a fusion or an ADR. And honestly, I want to hold off on that as long as possible. So, you know, if I squeeze a little more of that goo out this season snowboarding and have some pain, I'll probably be okay with having a second surgery. But you want to postpone that second surgery as long as possible, because if you do it a third time, like I said, it's a fusion or ADR, and ADRs aren't really done in the States, so you're gonna have to go overseas for that one. I did meet someone who's done that and had a very successful outcome. So that's interesting. You could look into that if you have the financial ability to take that on. What else? It's probably gonna be a while before I do another update. I have been running. I've been riding a bike. I have hiked. I'm very excited about hiking. We didn't, you know, this isn't gonna sound, depending on your background, this may or may not sound impressive. We did a 4-mile hike and I gained 800 feet in elevation, and that is an introductory beginner hike in my book. But coming, you know, having done that a year after spine surgery, I was pretty impressed with myself to have that, have no nerve pain, and then the next day after it was just a little bit sore. Not in my back, but down the nerve. It was a little agitated. So that's just what it was. I'm hopeful that with more training and practice and all these tiny little muscle memory things I'm working on with physical therapy, that you know, next summer I can be back climbing 14ers and hopefully running more and more throughout this winter to get my cardio and stamina back up. That's something that I didn't anticipate. You know, when you're not doing your physical activity consistently, you're out of shape. It's really hard for me to run 3 miles. It's really, really hard for me to do that. And it takes twice as long as it used to, because I run walk now. I don't have the stamina. So you have to build that all back up. And that takes time. And I think I'm just really hard on myself, and I don't think that you should be hard on yourself. If you're doing something, one thing every day to work on your body, even if today I didn't feel like doing my PT, but I really wanted to stretch, so I did a really cool stretch and floor routine before my morning started, and that's what my body needed. So do something every day to just progress a little bit, and you can get there. Thanks for watching, guys.